Hello everyone, this is Yoshiko Yamaguchi from Kwassui Women's University, Japan. Thank you for inviting me as a keynote speaker in this international conference. Also appreciating for the conference organizer and participants for holding this conference. Basically, I would like to attend on site. However, regrettably, I couldn't manage to travel to Singapore. So I also appreciate allowing to attend this conference by Zoom online. Our research is focusing on nurses, especially their mental health and intention to live work. Nurses are obviously predominant healthcare worker than a delegated substantial role for maintaining people's health. However, the number of nurses are insufficient in the world. Additionally, the low level of mental health were reported often. Therefore, we want to explore why nurses are leaving their work or which factors influenced their mental health. As you know that Japan is facing the serious problem declining birth rate and aging. This concern exists not only in Japan, some of East Asia countries, for example, South Korea, China, are in similar situation. Progressing people's aging, it means that more medical resource or money is needed for maintaining aged people health status. According to this situation, Japanese government has been pushed to manage the limited medical finance. Then there has been changing related some medical policy in Japan. One of that, the length of stay in hospital of patient hospitalization duration has become shortened. Many of people who need cure or care become stay in their own home or nursing home. Thus, more nurses work in home healthcare or nursing home. In previous, mainly nurses work at hospital. Now this has been changing. Nurses' workplace have become widely spread out of hospital. We saw that nurses' level of mental health or intention to live would be affected by difference of workplace characteristics. So we hypothesize that nurses' mental health or intention to live work level would be different by nurse workplace. As mentioned above background, we conducted the survey in Japan focusing on Japanese nurses and their workplace. We compared the nurses' level of mental health and intention to leave work among hospital, home healthcare, and nursing homes. Result: hospital nurses' mental health level and intention to leave work were the worst than home healthcare and nursing home nurses. This would be attributed to work stress. In hospital, shortened hospitalization duration is progressing. This means that many patients come and go every day. Hospital nurses feel more time pressure or work stress. Then this would relate to their worse mental health and high intention to leave work. Hospital nurses are working at the hospital. In Japan, now around 70% of nurses work at hospital still now. 4% of them work at home health care and 10% of them work at nursing home. Hospital nurses care for the patient who need acute care such as urgent or intensive care. Hospital nurses are needed to have high skill of medical and nursing. Hospital nurses are demanded to deliver high medical or nursing technique and being tense when they care for an acute patient. However, regrettably, they are also suffering from time pressure by the situation of shortened hospitalization duration now. We saw that hospital nurses' mental health and intention to leave work are the most problem in Japan. This should be researched to identify an effective way to improve it. We also saw that both mental health and intention to leave work are one's perception. May therefore both of those would be related. For example, some people would firstly getting lost mental health, then feel intention to leave work. However, other people perceive intention to leave work, then their mental health deteriorate. Additionally, intention to leave work contain two sorts of perception, which are intention to leave the profession, nursing, and intention to leave their organization. So we wonder following question, how these nurses' perception feeling are relate to each other? Our research question as follows. Regarding Japanese hospital nurses' mental health, intention to leave nursing and intention to leave the organization, how are these perceptions related to each other? Data were collected in the Kyushu district of Japan. We purposely selected two university hospitals in Kyushu district of Japan. They asked the hospital representative to give the permission conducting the study. After confirming their permission for conducting the study, we asked them to deliver questionnaire packs to target nurses. And 650 packs were delivered, then 444 were returned. And finally, we analyzed 413 completed written questionnaires. We measured target nurses' intention to leave nursing, intention to leave organization, and their mental health level. Target nurses' intention to leave nursing was measured using one item. What is your perception regarding your future job? Response used a 4-point scale. 1 is, I want to continue work as a nurse. 4 is that, I do not want to continue work as a nurse. Target nurses' intention to leave their organization was measured using one item. What is your perception regarding your future job? Response used a 4-point scale as well. 1 is, I want to continue working in this organization. 4 is that I do not want to continue working in this organization. Regarding both items, higher score indicated stronger intention to leave. We used General Health Questionnaire 12 for measuring the target nurse's mental health level. Higher score indicates low mental health level. We applied regression analysis to explore the relationship among these three variables. We repeated regression analysis with changing independent or dependent variables until showing the highest explanation ratio. This is result. This model, independent variables are intention to leave organization and mental health, GHQ score, and dependent variables was intention to leave nursing profession. In this model, explanation ratio was around 40%. This is the highest. Intention to leave nursing and organization are basically similar feeling, so this result, intention to leave organization was the most influence variable, would be convincing. Other hypothesis model in which the dependent variable was intention to leave organization and independent variables were mental health and intention to leave nursing. Mental health was not sure, significant relation to intention to leave organization. Intention to leave organization contain positive feelings such as career up. May therefore mental health was not related to intention to leave organization, contrary to intention to leave nursing profession. From our study result, if nurses feel intention to leave organization, their mental health would not be a problem. However, if nurses perceive intention to leave nursing, this possibly indicates that nurses' mental health level may be in low. Implication for practice. Nurse managers should treat on their staff nurses' intention to leave nursing and intention to leave their organization separately. If the nurses say that he or she wants to leave nursing, not organization, they may be suffering from low mental health. Thank you for your kind attention. Thank you very much.